Well, good morning, everybody. My name is Shelley Lopez. I am the Department Director for Ambulatory Nursing here at Children's Hospital. We'd like to first thank the Louisiana Department of Health for extending us an invitation today to talk to you all about chronic care management in the school setting. We have a short agenda for today. Items are included here. We'll begin with some brief introductions of our student wellness team, followed by an overview of chronic care management and the services that we are prepared to offer you today. And then we'll talk about other supportive resources we have available. You are our community partners, and as our Chief Executive Officer, John Nickens, likes to remind us daily, we definitely function better together. So we look forward to offering these services to you all. With that being said, introductions are in order. You can see we have a lot of members of our clinical team here at Children's Hospital that are slated to help in the school wellness initiative. I'd like to first start off by introducing Dr. Amanda Jackson. She's our Vice President of Provider Services and also the Medical Director of our primary care clinics. Dr. Jackson, are you there?
Sure. Hi, good morning, everyone. So glad to be here. I serve Children's as the Vice President of Physician Services and the Medical Director for Primary Care. I'm also a pediatrician by background. I've been involved with virtual care and innovation and informatics for years now. So it's a thrill of mine to be able to connect both students and teachers with additional support from children through virtual care and using this new modality because we want to make sure that we get the kids back in school safely and to keep them as healthy as possible. So thanks, Shelley.
Thanks, Dr. Jackson. Next, we have Dr. Aaron Martin. Are you available, Dr. Martin?
Yes, coming to you from the OR. Sorry for my tardiness. I'm the medical director for virtual care here at Children's. The school has always been a goal of ours since starting virtual care about 4 years ago, and I'll talk to you more about it later.
Great, thanks. Next up, don't quite know if he was able to hop on. That would be our school wellness medical director, Dr. Tony Gonzalez. I'll just double check to see if Dr. Gonzalez was able to hop on. If not, I will just do a brief introduction for him. Don't quite see him. That's totally fine. So in addition to being our student wellness medical director, he is also our service line chief for orthopedics here at Children's Hospital. He's currently hosting clinic right now and sends his apologies that he couldn't hop on, but he is very much looking forward to working with you all. He also partners closely with LCMC Health with our sports trainers who do a great service to a lot of the schools that we have on the line today. Next up, we have Dr. Denise Carute.
Good morning. Thanks for joining us. I'm so excited to be here as well. I'm a pediatrician with Children's Hospital, and my practice supports virtual care for children in school and in the community and other school wellness initiatives. And I'm born and raised in New Orleans. I've trained at Charity Hospital and Children's Hospital here, and I'm very passionate about improving the health care for the kids in Louisiana. Thank you for all that you do in our schools.
Thanks, Dr. Carute. As I've said earlier, my name is Shelley Lopez. A little bit about my background. I've been a pediatric nurse for over 24 years. 17 of those years have been with Children's Hospital, and most recently, the bulk of my profession has been in the ambulatory outpatient setting. I am board certified in pediatrics, and my primary responsibilities now are to promote clinical excellence with our primary care clinics and our specialty care clinics, who currently promote services throughout the state at over 20 different locations. And next up, we have Patricia Hewen, who is our student wellness nurse manager. Go ahead, Patricia.
All right, I am the real Patricia Hewen. So, as Shelley said, my name is Patricia Hewen. I'm the new nurse manager here at Children's Hospital, dedicated to our student wellness program, also known as Thrive Kids. I joined the Children's Hospital team over 6 years ago, and I've been a school nurse for the last 2 years. I'm excited to be able to bring together Children's Hospital and the school system. I want to start by saying thank you to all the school nurses and all the personnel in the school system for what you do. I know firsthand that you face many challenges daily. We know that you see many chronic conditions. I'd like to speak on a few situations that we could be of assistance to you. You all have probably experienced those situations where students come to school with a dressing, a boot, or a cast, things like that, without a plan of care from the doctor. Getting information can be a real challenge. Another common challenge is getting medications checked in at school with orders that do not comply with policy, or perhaps a meal modification form for children who have food allergies. You know as well as I do that we can spend an hour just listing chronic conditions that we manage daily. Our team can be that point of contact so we can assure the information and necessary training is received. For example, we have a team of 54 nurse navigators who work in 22 different specialties that serve as subject matter experts. These men and women work hand in hand with our specialty providers and are a critical part of patient and family education on various disease processes. The common chronic condition that we'd like to focus on today is asthma. It comes to no surprise to know that it is the most common, affecting up to 20% of children with nearly 40% uncontrolled. There are many children with an asthma diagnosis that do not have the appropriate medication. Maybe they don't even have the diagnosis, but the signs are all there. If these kids are at school with symptoms, they need to be evaluated. To assist with expedited care, we could set these students up for an in-school virtual visit. Dr. Karut, can you tell us more about the current guidelines for asthma management and how these kids can be evaluated virtually?
Yes, thanks, Patricia. So asthma is a very common condition in children, as you all know, and it's a chronic inflammation of their airways, which causes constriction, which leads to wheezing. When children present often at school times from the playground to the nurse's office with their wheezing, the first thing to do is assess them, check their respiratory rate, check their color, look for their work of breathing, and get your overall picture of the child. And of course, as you know, call 911 if they're in severe distress and get them to the hospital right away, because asthma can be a life-threatening illness. Then listen to their lungs with your stethoscope for any wheezing and check their air movement. Sometimes if they're having a really bad attack, you won't even hear anything because they're not moving air adequately. So that's a good assessment tool in your arsenal. Then give them 2 puffs of their albuterol inhaler, and you can give them up to 4 if the 2 isn't working. Luckily, most kids, when they come in, are not going to be in severe respiratory distress. It'll be mild. And the latest studies show that if you properly use the inhaler of albuterol, and preferably with a spacer if they're younger than 9 years of age, that can be equivalent to using a nebulizer. So you can use either one at the school or at home, and they should get some symptomatic relief pretty quickly. If they don't, you can give them another 2 puffs and reassess as well. And this will be a good time that if you feel like if you're wondering if they got it or not, ask the child, do you taste that medicine that we gave you? And they should taste it if it got in there. And this would be a good time also to consider virtual care. If your school is partnering with us and you have a virtual care ability there, it's simple. You can just pick up the phone, give us a call. I can answer your questions. I can see the child, and we can do a visit at that point. So if, let's say, our little child is called Katie, and she comes back again in a few days, or maybe she's coming in every week, like a couple of times, she's having all these breakthrough issues with her asthma, that would be a good time for her to visit a pediatrician and see if she needs some other medicine to control her asthma. Because as you know, we have a whole arsenal of medicines. And so if she's having more than 2 episodes a week, the latest recommendations from the American Academy of Pediatrics are that she be seen by a pediatrician and that a controller medicine be added to her regimen. So she would be using her albuterol inhaler and then also be using a steroid inhaler to help control that inflammation in her airways. Then we have some other medicines too that are combinations of albuterol and a steroid that they can inhale. And then we also have another one you've probably heard of called Montelukast, or is commonly called Singulair. And that one used to be prescribed a lot for the allergy symptoms that go along with a lot of children who have asthma, and they can be a trigger for their asthma attack. But the latest recommendations are that that is not recommended anymore unless the child really, really, really needs it, because it now has a black box warning. And the reason for that is that it can cause some psychiatric effects like depression, suicide ideation, and sleep problems. A lot of children on that medicine they found had sleep problems, so we really don't recommend it. These other newer medicines are better to manage their symptoms. So back to the triggers, we do want to educate the children and their parents as much as we can about their triggers, because one child may react to pollen in the air and have allergies to that triggers their asthma attack. Another may be sensitive to dust. So if it's a really windy day, they may be needing their meter dose inhaler of albuterol because that may trigger their symptoms. Some children are sensitive to cold air. Most are sensitive to viruses. So if they get like a rhinovirus, which causes the common cold, that can stimulate those airways and cause them to have an asthma attack. So the key to managing it is to keep it under control with medication and with education, and try to get them to where they're just living a normal life like all the other kids. They can run around on the playground, participate on sports teams, and have almost normal lung function if they're managed closely and well and with the proper medications. So the recommendations are that they be followed at least every 2 to 3 weeks until they're under good control, and then that they see their primary care physician about every 3 to 6 months to make sure we're still fine-tuning them and keeping their lung function optimal for them so that they can live their best life. And that's what I'm so passionate about, is helping these children with chronic illnesses like asthma, diabetes, and many others, sickle cell, that they can live as best a life that they can, just like all the other kids, and have fun on the playground. And so that's why it's really exciting that Children's Hospital is partnering with you guys. I love that we're getting into the schools to support you where the kids are. And I hope that we can be a big help to improve access for these children to healthcare, good quality pediatric care through our virtual care system. So the way it works is just like this. It's a Zoom call, and they can see me at the school. I can see them. I can assess the student, see what their symptoms are, get them back to class quickly if they're not infectious and contagious to the other students. And if they are, I can get them home quickly so that we don't spread the illness to the whole class. And I can meet their needs quickly and conveniently, and their parents can stay at work, don't have to leave. It eliminates all the need for transportation. So if they have transportation issues, that becomes no problem. If they need a prescription medicine, I can send it directly to their pharmacy and they'll get it that day. So it's very convenient and easy, and it improves the access to quality pediatric care for these children. And that's what really is so wonderful about this program. And we can deal with acute.
Dr. Carruth, I think you muted yourself accidentally. Could you repeat that last sentence?
I'm sorry. Yes, if they have something like conjunctivitis, commonly known as pink eye, or a skin infection, like commonly known as, well, it's also known as impetigo. Things like that that need a prescription, I can send that in and get them treated right away. Things like scabies, we can get them treated overnight. I had heard a story from one school when we started that broke my heart, of a child who had that and missed school for a month because they never got their prescription. Nobody had ever been able to get them to a doctor and get a prescription and get them treated. And that's something that we can treat today, and you're back in school tomorrow. The other benefits of our virtual care are that children have less missed school days, parents have less work missed, and we have a permanent record in our electronic health record of the visit. So the parents can go back and view the visit, see what my recommendations are through our program called My Chart. And also their primary care physician or their pediatrician can log on and see what I did as well. So there's a permanent health record of what has transpired, which is a wonderful thing as well. And then it's so quick and easy, and it just helps get the kids what they need. And also, if they need a referral to a pediatrician that day to be seen in person, I can facilitate that, because maybe their doctor doesn't have any openings that day, or they don't have a doctor, many children. And then the other thing is, if they need a specialist referral, I can put that in for them right away and get them over to see one of our fantastic specialists at Children's Hospital. We have wonderful cardiologists, pulmonary doctors, and endocrinologists and allergists. So we've got all the pediatric specialties. And so with that, I'm going to hand it over to Dr. Martin to talk about our specialty virtual care. Thank you so much, and I appreciate all you do. If you need anything, please don't hesitate to call me anytime, and I'm happy to help you and support you, because I'm passionate about improving the health of the children in Louisiana. Thank you.
Thank you, Dr. Carute. I think the one thing she missed was she didn't mention the excellent pediatric urologists we have at Children's Hospital. I'm a little biased though. But yeah, as she said, the virtual care, we started this about 3 to 4 years ago with basically two major goals in mind. One, to reach kids where they are the most, which is at home and at school. To date, home has really what we've mastered, and school is what we're here to talk about today. And the second was to enhance the care we provide, not to replace it. And so as she said, we're giving a record back to their pediatrician. We want to make sure that they can stay in school, that the parents don't have to leave to treat minor conditions. And so to that effect, that's where specialty care can really come in, such as treating diabetes and doing sugar checks and counseling with parents who maybe have had trouble getting the kid to their specialists outside of school hours. Doing seizure monitoring, behavioral health is a big one that lends itself perfectly to virtual care. So these are all services that we're able to provide. And we went from about 200 visits a month pre-COVID to now, after COVID, all of our specialists have been exposed. They're all very comfortable with the platform. They're all very comfortable with what we can treat effectively over a virtual platform. And so now we're seeing close to 2,000 visits a month, and that's just to the home base for the most part. And now we'd love to be able to enhance the care that the school nurses are already doing an excellent job of, and be able to help them out when it's needed. Because we know probably 99% of the things that come into the school nurse's office, y'all are more than qualified to handle. But there's those few things that really could help, like getting the antibiotics called in, getting, if it's just a follow-up set up, or getting them to their follow-up that they couldn't make otherwise, that will really help these children. And so we're excited to be able to partner with you guys to make that happen.
Awesome. Thanks so much, Dr. Carute and Dr. Martin. So as you can obviously tell by the passion and enthusiasm of our physicians, this is a really exciting time in pediatric care. Final agenda item we'd like to talk about is student wellness. As Dr. Carute and Dr. Martin mentioned, There's an array of services that Children's Hospital has been offering for over the last 60 years. And we're very excited that that is now bridging over to the students at the school setting. So as a summary of all these supportive services, in addition to the chronic care management that Patricia mentioned and the virtual care options that Dr. Martin and Karut mentioned, we can also offer the following that are here up on your screen. We've been very passionate, involved with COVID-19 support over these last few months. We have a dedicated school nurse hotline to answer all of your questions. Mental and behavioral health services that are so very important right now, especially because life as we know it has changed quite a bit in these last 6 months. And also sports medicine services with our school trainers and throughout the area. So these are definitely innovative school-based programs, and they're an important part of Children's Hospital's mission to be a community-based partner. We're committed to investing these resources with you guys because you are our community partners, and we want to understand your specific needs. We know every school functions a little bit differently, but at the end of the day, the goal is the same, is to keep kids healthy, keep kids well, and make sure that they have a bright future. This next slide is just a summary of one of the many examples of the partnerships that Children's Hospital has been able to participate in. I do want to extend our sincerest appreciation to the Louisiana Department of Health and also the Louisiana Department of Education with their tireless efforts over these last couple months, getting our teachers, our faculty, our staff, and our students back to school safe and well. This collaboration has reached schools across the state. We've been able to offer one-on-one medical consultation, with schools and school districts from throughout the state to implement Louisiana Department of Education and CDC guidelines so that you can open prepared as well as we can. We've also offered virtual town halls. Louisiana Department of Education has been key with that, and that has been designated to school nurses, teachers, administrators, and also support staff at the schools so that we can get your questions answered. We have downloadable resources on our website, such as this COVID-19 decision tree that again has been partnered with the Louisiana Department of Health. And also that hotline that we keep mentioning. It's for school wellness, but it's also a direct link to the virtual care services that Dr. Karut and Martin just mentioned. We can assist with community testing resources, returning to school screenings. Those who have had issues with COVID-19, we have a program to help you monitor those symptoms at home. And lastly, we are very excited, actually thrilled to announce that we are launching our Thrive Kids Student Wellness Initiative project this evening. So this is a comprehensive program that combines all of the resources, programs, and services that we've talked about today. We are committed to getting kids healthy and meeting them where they are, and through at least 8 hours of the day, that's at school with you all. So this program is designed to enhance their well-being and keep them safe, and in turn take care of you guys because you take care of them as well. We want to work together with you. We're going to provide tools, services, education, inspiration, and the expertise to help you and to help our kids grow up healthy and thrive. So this event is actually launched tonight at 7 p.m. It'll be live streamed on our website, which is chinola.org/thrivekids. We have a few speakers, a lot of great information to share, and because it's children's, we'll be having some fun as well. So at this time, we would like to offer you an opportunity to answer any questions that you may have. I do see the chat feature lighting up a little bit, so for those of you who do have questions, please feel free to put them in the chat box. So let's scroll up real quick and see where we are.
So I see one from Rebecca about behavioral health. I apologize, I don't know the exact wait time for behavioral health services. As you know, those have been in great demand before COVID and even more demand after. But if you could send us an email, we'll check into that because they certainly should get back to you within 3 weeks. That certainly seems a little longer than usual, but there's several different mental health programs that we have out there, especially to see the kids directly from home. Now, if you're referring to see the kid in school, that's something we have to make sure we have the proper agreements set up with the school itself to be able to facilitate it in the school as part of that program. But certainly to see them at home, we are up and running and doing virtual visits for behavioral health every day. So if you could just send me an email at my email is amar16@lsuhsc.edu. I'll make sure I look into that and get you an answer.
All right, just monitoring the chat box, what we have now. So if you'd like more information on Thrive Kids, it's actually available on our website. I do have that link on the next slide. So I see Stephanie's asking about our food allergies, diet prescriptions, something that could be done through this service. Dr. Carew, did you want to talk a little bit about that?
Yes. Yes, we're available through virtual care to help with all those types of needs. Through our partnerships with schools, we can deal with any allergies, food, nut, shellfish, anything. And we want to make sure all those children who do have those allergies have an EpiPen at school ready for them to be used in case they need it. That's been proven to save lives, and it's very important. And I'm passionate about that as well. Those children need those EpiPens at school where they are most of their day. They also need them at home too. It's very important, and it can save their life. And don't be afraid to use it, and call 911 if you need to. So I'm happy to facilitate them getting those prescriptions through a virtual visit. That's a perfect reason for one. Thanks for that great question.
Okay, thanks, Dr. Carew. I do see another question from Ramona asking if the child at school that may be presenting with the condition, do they need to be in Children's Hospital's database to be treated with the virtual health options that we have? Dr. Jackson or Dr. Martin, could you help with that question?
They do not. So we can register him in our system just so we have a record available and the ability to prescribe and things like that on the fly when you call. So they don't have to be a pre-existing patient of ours, nor do we plan on usurping their care to Children's. Again, this is just to enhance the care they get. We're not there to replace them. We're not there to replace their pediatrician. We're just there to help them in the immediate problem.
Dr. Jackson, anything you'd like to add to that?
You know, I totally agree with Dr. Martin. This is truly here as a additive help. The primary care doctor, the patient's general pediatrician will continue to be their pediatrician, and we're here to help out. We are here to help when, you know, if a school needs any documentation of their prescriptions, or if they need, you know, if you recognize, like, EpiPen is a great example of that. As a child, as a mom of children that have a child with a food allergy, making sure that his high school has his EpiPen, you know, if it expires because he doesn't use it and they realize that it's expired, this is a great resource to be able to start a video visit to get that appropriate medication. So as a mom, I would appreciate that as well. And he would, of course, go back to his regular pediatrician for all of his routine care. I just did want to touch real quickly on the COVID questions. I just wanted to remind everyone that we do have these COVID resources on our children's website that you can access. We want to make sure that all schools have the resources that they need to return for the children and the teachers and everyone to return to school safely. So please, if you go to genola.org, you can find all of these resources for you. So thanks, Shelley.
Don't see any other new questions popping up, but we'll give it just a few more minutes. I did want to highlight a little bit about what Patricia had mentioned as far as just an extended example of our specialty services that we have. So Patricia mentioned our RN Navigator team. These are, I call them the nursing fellows of Children's Hospital. They work hand in hand with all of our specialists throughout the whole organization, and they themselves are very familiar with the plans of care with their doctors. So they can definitely service as those, you know, quick options for, you know, that quick question. This seizure looks a little bit different. I'm noticing a trend in those blood sugar levels going up a little bit, or when was the last time that this child had their asthma inhaler refilled? If they're already set up in our system, we're absolutely able to help facilitate the questions that you guys may have so that you can hopefully use us as the resource to be proactive with these kids and make sure their time away from school is minimized if at all possible. All right, well, if there are no extra questions, I do want to thank you guys again for having us participate in today's presentation. Well Ahead, Louisiana Department of Education, and LDH have been key players with everything we do for students, and we're definitely looking forward to partnering with you guys even more. If you do have any other particular questions for us, again, you can go to our resources on the website, shanola.org/thrivekids, or our email address is there as well, thrivekids@lcmchealth.org. That is a one-stop shop for any questions, and you can always use that as a route to get to any of us on the presentation today. Thank you guys so much.